Good afternoon, everybody. I'm Craig.
And I'm Brittany.
And we are here with IPT Virtual to talk to you today about back pain. Back pain does not care if you are tall, short, fat, thin, male, female. Back pain is going to get you one way or another. So what we want to talk about today is how do you handle your acute back pain? Acute back pain is that time you bend over, you pick the pencil off the floor, and oh, my back goes out. Or in case of a gentleman that I saw yesterday, he had a really long, tough workout. He was really fatigued, and he tried to do a deadlift of a lot of weight, and he overcompensated, and boom, his back went out. So what happens when that goes on, when your back goes out, so to speak?
So it can be a couple of different things. If we're talking more on the discogenic side of things, then we're talking about that disc bulging or coming out from where the spine is. So, well, he's being covered right now. But basically, you have all
It's cold in Miami.
It is today. So you have all these discs inside your spine. And when you go and you bend forward or you lift something up, what happens is it pushes out almost like toothpaste coming out of the tube.
Yep.
Okay, and if that moves more than it should or pinches on a nerve, then that's when you're going to have that irritated, sharp, maybe tingly pain that radiates. So if that's the case, then that's going to be, like I said, discogenic in nature.
Right.
Usually, if you're a little bit older, if it's more chronic kind of stuff, then you can have stenotic kind of back pain, which is going to be more so compression in the spine, decreased joint space in between the vertebrae and stuff like that.
Right. So what we want to be able to do today is have the conversation around muscle spasm, right? And let's assume that we've cleared all the red flags. If we've got loss of function of the leg, if we have a drop foot, if we have loss of bodily function, if we have all those things that have been cleared by whether it be diagnostic testing or a visit from the physician or even clinical testing within an environment like ours, let's clear that out and let's assume that we're dealing with more muscle spasm based irritation around the spine.
Yeah.
All right. So what are we going to do first? First, we're going to make a determination on what directional preference is. What that means is, does moving in a forward flex position make your pain better or worse or the same? Or does extension work make your pain better, worse, or the same? So what we're going to do with Brittany here, we're going to go through just a very easy, gentle way. So this is assuming that we've rooted out all the red flags and we've gotten rid of anything that we need to do for any medical intervention, and we're now looking at physical stuff here. So I'm going to ask Brittany just to bend forward nice and slow, reaching downward, and what she's looking for is, does her pain increase, decrease, or stay the same? When she comes back up, now Brittany's perfectly fine today. She doesn't have any back issues, but imagine if she did. When she comes back up, she's going to get some tenderness in this area. So maybe what we can do is bend the knees a little bit, use the hands on the thighs, and walk our way back up. So from here, coming back up, better, worse, or the same. If we went into extension, I'd ask Brittany to place her hands on the back of her hips, opening her hips forward, pushing forward, and leaning back. Now, how far back she leans, again, Brittany's got nothing going on with her back today, so she's able to get a large range of motion. If you have a spasm out back, you're probably not going to go very far. And you're going to know after 3 or 4 or 5 repetitions which direction that you are preferring, which is decreasing your discomfort. Is it flexion or it's extension? That's going to determine for you, specifically you, which exercises to do to help you decrease the spasm of your back pain.
And you can also be getting better based on the centralization of any symptoms. So if you have anything that's referring from the back down into the butt, down into the leg, whatever it is, as you go through a couple repetitions of that preferred range of motion, you'll find that, let's say your foot had some tingling in it, that the tingling out of the foot is coming out of the foot and maybe working its way up back into the spine. So it's centralizing back to its main location. So it's not always just the back pain that we're talking. Sometimes it's that irritated nerve running down the leg as well.
And what we talked about earlier, what Brittany was talking about, the discogenic versus more the musculoskeletal type issues here. If a disc is impinging upon a nerve root in the central canal, your symptoms are going to be very significant. That doesn't mean that if you have compression of a nerve outside of the canal, they're not, but it's different. A muscle might go into spasm and the nerve root travels through the muscle. Masm goes into, I'm sorry, not a nerve root, but a nerve branch goes through the muscle. Muscle might go into spasm and compress that and give you those lateral symptoms or distal symptoms that come down the leg. And the idea of what we call centralization is that symptoms coming further up, closer to the central part of the spine. And that's how we determine a successful treatment: centralization, decreased pain, and decreased spasm of the spine. So what's next? We're going to show you a few exercises. So hang out. We're going to show you some flexion exercises. We're also going to show you some extension exercises. So do your test at home to determine is flexion the right way to go for you, or maybe it's extension. We've gone through our directional preference exercises to figure out which is the way we want to go, and we're going to start with flexion-based exercise. That is, when you bent forward, you had relief of your symptoms. You did this 3, 4, 5, 10 times, and your symptoms centralized, released. You got better doing it. So we're going to do flexion-based exercises. The first one that we're going to do right now is a single knee to chest. And every exercise that you want to do is going to be very gentle. All right? If you're in a lot of pain, if you're in a lot of spasm, your movements are not going to be quick. They're not going to be forceful. They're going to be slow and very deliberate. So I'm going to ask Brittany to bring one knee up towards her chest. And in this motion, the flexion is coming in the spine because it's rotating backwards down into the table. However, keep in mind that it's minimal motion. The spine motion, because she's lying down on a table, the motion that you're seeing a lot of here is happening in the legs and the hip, the knee, and whatnot. So we don't want to crank down on that knee towards the chest. We want to do it nice and gentle and easy. And let's switch sides. And we're going to do 10 of these, by the way. We want to be very gentle and slow with the motion coming down towards the chest. We don't want to pull really hard. We don't want to hold our breath. We want to continue to breathe. We want to be very gentle with the motion as we create a rocking motion of the pelvis.
And one of the cool things that while you're watching this right now, you might even notice is that sometimes you find these things out before you even come to see us. So if you notice that those back spasms have been bothering you for a day or two, and you're like, but when I lay in bed and I do hug my knee into my chest, it feels better. So your body's going to tell you a lot of times where it wants to go. You do what feels better. If the symptoms are decreasing, you probably know more than you think you do, or your body already tells you what to do.
Your body's very smart. It's very intuitive. Now, one thing that I do want to bring into the conversation around acute low back pain or acute pain in general is oftentimes the body goes into protection mode. We start to hold our body really tight, and the one thing we forget to do is breathe. So let's talk about breathing. As Brittany goes through these exercises, let's talk about breathing. Breathe in through the diaphragm. Let the air come in, the diaphragm drop into the belly. Let the rib cage open wide. Almost imagine your rib cage leaving an imprint on the floor or on the table. That breath will allow the rib cage muscles to open and close, and those muscles are also in spasm. So we want pain-free, positive range of motion to occur.
Yeah, I think we're good with these.
Okay, so the next exercise we're going to do from here is a very gentle pelvic tilt. But before we actually do the tilting and the movement, we're going to prep it. So what we're going to do, the first thing we're going to do is engage the feet into the table, nothing more. Just by engaging the feet into the table, you're going to feel the hamstrings and the butt muscles start to contract. And if it's able to, your spine will then flatten into the table naturally. So let that relax. Again, focusing on your breathing. Start by pushing your feet into the table, your knees towards your toes. Your hip will automatically come back into that flexion moment, creating just a slight bit of easy motion in the spine right here in the bottom. How's that feel?
Good, and I can feel the space opening up in between the lower segments of my back.
All right, so we have 5 lumbar vertebrae that are in the low back. We have 5, and then we've got 12 in our thoracic and 7 in our cervical. So again, it's 5 down here, right? We've got 12 up in our thoracic and our cervical up in our neck. We have 7. Most times when we have spasm or over repetitive motions, we chunk those vertebrae together and we move 3 or 4 or 5 of them together as one. And a healthy spine should be able to move individually into multiple different ranges of motion with stabilization, of course. So the idea of these motions is start slow. Start very gentle, very easy. Maybe it's just a little bit of pushing a foot down into the table. Maybe it's a little bit of a tilt before it becomes more of a larger tilt. I do not need you to lift off the table at all. All we're doing now is just creating some very nice massage into the spine.
Your body wants to move, and sometimes when you're in pain, you go into that major protection mode and you don't move at all, and that just cycles into a bigger problem. So what we're trying to do here is just create, like Craig said, that gentle, pain-free range of motion. Keep the movements small, keep them frequent, then we're good.
And from here, I'm just going to ask Brittany to just do some gentle knee rocks. Now a knee rock has a lot of motion to it. It does flexion, it does extension, it does rotation, it does all these different types of motions. And the most important thing that it does is it moves the body. It teaches the body that it can move in a pain-free, positive range of motion because our body is now in a protection mode of acute contraction. We need to teach it that it's safe to move within these ranges of motion. So if it moves and is pain, the body's going to think and remember pain and compression, contraction, and guarding. If it moves without pain, it has an experience of a positive pain-free range. So I always like doing gentle knee rocks, 2 or 3 or 4 inches, again, just to lubricate the joints in the low back and the spine, get the muscles just to recognize that motion is okay. And in between my exercises, I always like doing this. So let's go into toe taps, okay? So a toe tap is a wonderful exercise where the abdominal muscles become supportive of the spine and we move the hip around a very supported spine. So all we're doing here is lifting one foot and then the other. To create that stabilization, what Brittany's doing is pushing down on the right leg as she lifts the left. And then she'll push down on the left before she lifts up on the right. And again, what this is doing is creating a stable environment for what's called disassociation or mobility or movement of the hip around a very stable environment, which is the spine.
And an easy compensation if I didn't do that push, as you guys can see, my back here is arched off the table. So if I go to lift and I don't push down to that other leg, then I lose that connection of my back with the table. So that's why it's super important that every time that I go to lift the opposite side, I'm pushing down the foot on the other leg.
Good. So we're going to do a couple more here, and then I'm going to ask Brittany to go into knee rocks once again for us. And again, the knee rocks are just a way to move the spine, to move the hips, to move the musculature, to allow freedom, pain-free, positive range of motion. We're breathing wide through our chest, deep into the table. Good. And now this next one we're going to do is our last one, and it's a little bit more complicated and a little bit more fun to do, but it's a combination of everything we've done, okay? So we're going to start here on the right side with Brittany, and I'm going to ask her to push her foot down into the table. Knee's going to go towards the toes, and the hip is just going to lift slightly and rock across. And that's it. It's a very slight, gentle motion. Come on back down. We're going to do the same thing on the other side. So what we're trying to do here is almost a knee rock without the knee rock. It's more of a hip rock, right? And what we're doing here is we're creating separation of musculature that is over-contracted. The key to this exercise, get out of your own way, okay? Because if Brittany pushes both feet down, her tush is going to lift, all right? So as she pushes down with the left, the right has to let go, and vice versa. When she pushes down with the right, the left has to let go. Well, this is reciprocal motion. Motion's happening on opposite sides. This is very much what happens when we walk. One leg moving forward, contraction, relaxation, one arm thrusting forward, the other one coming back. This is what our body needs to return back to for a pain-free, positive experience of motion.
I like this.
This is just a really nice massaging type exercise to create motion. Now, if we were in, again, acute spasm and we wanted to do rolling type exercises, this is a great way to start that rolling momentum. So by pushing one foot down, the knee rolls, the hip goes, and we just continue that motion all the way across, right? And then we come back and we do it the other way. One foot, one hip, create separation, and roll all the way across. We'll go back the other way. One foot, knee push, hip rolls. And again, if you can imagine what's happening throughout the body here, we're literally creating a massage of musculature, bone structure, and just overall joint mobility. So that's a great way just to start in some of the flexion-based exercises if that is your directional preference. And again, we're going to teach you the other side too. That's going to be the extension work coming up in just a moment.